Okay. Good evening. This is the competency station for needle chest decompression. Jay's going to walk you through the anterior approach. That is the most common approach for chest decompression. Jay, take it away.
Okay. First things first, we listen to our lung sounds. And if we had absent lung sounds on one side, absent radial pulses or hypotension, also tracheal deviation, that's a late sign, we would decompress. So normally when we decompress somebody, we would use a 14 gauge, 3 1/4 inch needle. I'm not going to use that on this mannequin. I just wanted you to see what it looks like. We will use a smaller needle for demonstration purposes. So we would find our landmark, which is going to be the second intercostal space. It's hard to feel. Mid-clavicular line. We clean from the inside out. At a 90-degree angle, we would until we hear a hiss and a pop. Correct our catheter, then we place this right into a sharps container and cover it with an abdomen chest seal to secure the catheter. Then we reassess our patient for chest sound lung sounds.
What is the benefit of using an Asherman chest seal?
Stops air from going back in and also keeps the catheter in place, protects it so it doesn't get knocked out
or kinked. Okay, excellent.
So that's how we would do a anterior one.
Okay, so Jay's going to walk us through an alternate approach, which is the lateral decompression site. Go ahead, Jay.
Okay, so sometimes we cannot decompress from the front, so we have to go to the side. So we come down to the 5th intercostal space on the front, follow it around to the anterior axillary line, and we clean the site from the inside out again. Insert the needle till we hear a hiss, feel a pop, and then we would place the Asherman chest seal over the catheter end again.
Okay.
Again, we'd reassess our patient to see if it was effective, if things improved.
So what are we looking for after we do a chest decompression? What clinical...
Actually, the patient that I actually did it on, you knew right away that you hit it and stuff. He could breathe a lot easier and stuff. He was a lot. He wasn't so happy they stuck a needle through his ribs, but he was a lot happier he could breathe. And
can you tell me why we want to ride over the 3rd or the 4th rib, depending on which site we're doing?
Because all your nerves and your blood vessels are protected by the ribs on the bottom side.
Excellent.
So you want to try and stay away from them as much as possible.
Excellent. Okay, thank you, Jay.